Pertussis, also known as whooping cough, is a very contagious disease that can be deadly for babies. Research at the Los Angeles Biomedical Research Institute is finding that vaccinating a woman after she has delivered a child helps protect the mother as well as the baby. Dr. Sylvia Yeh discusses this disease and her research.
The study that we were doing is specifically looking at improving vaccination against pertussis in moms right after delivering babies. And so infants are your most vulnerable population in terms of when they get pertussis. Many of them go into the hospitals and they are there for a long time. Some can die. But they are too young to be able to get vaccinated. When babies have pertussis, where do they get it from? It's oftentimes someone in the home, and 30% of the times it's at least the mom, if it's not the siblings, if it's not grandma, the grandparents. And so in 2006 is when the vaccination became available. It's called Tdap, TDAP. It's an adult version of the childhood vaccine called DTAP that they get. And it was recommended that all household contacts of young infants get vaccinated.
There are serious complications for babies from pertussis.
Oftentimes babies can stop breathing, they can cough so much that they turn blue. Sometimes it then develops into a very bad pneumonia where they need to be on ventilators to support themselves, to be supported. Sometimes with really bad breath, when they can't breathe, it can cause brain injury and they get encephalopathy.
Dr. Yeh discusses the symptoms and complications of pertussis for adolescents and adults.
Oftentimes whooping cough can present just as a very prolonged cough illness. It's typically traditionally known as a cough of 100 days. Kids, when they would have whooping cough, they would cough, 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 get to a point where they couldn't breathe anymore, and that's when they would take a big gasp, known as the whoop. And so in adults, they don't necessarily have that as much, but they have those protracted coughs. And there are complications from that. So sometimes you can get retinal hemorrhages, you can get conjunctival hemorrhages, you can get pneumothoraces, women can get urinary incontinence.
The study found a much improved immunization rate for these new mothers.
When we surveyed moms during this time, almost all the moms were like, yeah, if I'm willing to get a vaccine if it's going to protect my daughter or my son from getting sick. But so you're protecting both. You're protecting the mom, but ultimately by protecting the mom, you're hoping to protect the child. And then also, this vaccine is available so that she can also make sure that the father of the baby gets vaccinated, or that the grandparents, or anyone who's going to then care for the child, she would also then recommend or encourage them to get vaccinated. And all of them basically is you're trying to create the home where the older people who can get vaccinated are protected against getting pertussis so that the baby is not exposed to this pathogen.